Hello viewers, this is Dr. Rivati Ramaswami from Apollo Hospitals, Secunderabad. You all must have heard of hysteroscopy. Hysteroscopy means seeing the inside of the uterus with a very tiny telescope. Why is it done? People with more bleeding, people with less bleeding, people who have problem with pregnancies, infertilities, people who have repeated abortions, this and so many other reasons when we have a look inside the uterus. This is an advantage because some years before, visualizing the inside of the uterus was not possible directly. And now with our advanced equipment, we are able to not only see inside the uterus, but when we find small, soft growths like polyps, we find fibroids, we can remove them at the same time. These are commonly the causes for heavy bleeding. If we find bands which are sticking the uterine walls to each other, these are called adhesions, and these are the cause for very reduced menstrual bleedings. We can release these adhesions and make the cavity one. Sometimes some women have a congenital problem in which the uterus, instead of being one, is actually two. There is a wall in the uterus that makes the uterine cavity into two. So one of these conditions is called a septum or a wall in the uterus, which can be easily diagnosed and cut, and the uterus becomes one again. So of course, in cases of repeated abortions, we can find these adhesion bands. Sometimes we can find inflammations inside the uterus. We can diagnose as tuberculosis inside the uterus. So hysteroscopy is a very, very beneficial tool, and the use of hysteroscopy sometimes in an older woman can prevent a major surgery called as a hysterectomy. So utilize this technique, friends. Thank you.